Hello everyone, I'm Dr. Colette Harman. I'm a naturopathic doctor and who treats pain using acupuncture, and
I'm Tessa Shier, and I'm a registered acupuncturist in the field of Chinese medicine.
now what we're talking about today is the use of acupuncture for the treatment of chronic pain in the pediatric population. So I want to go through a few definitions to start. When we refer to pediatric patients, we're basically referring to anyone between the age of 0 to 18 years. And when we're talking about chronic pain, there are two ways of describing chronic pain. The first one is pain that is recurrent, such as headaches, limb and joint pain, or abdominal pain, or even growing pains in children. And the other definition of chronic pain is any kind of pain that's been lingering for more than 3 months, and that can include, back pain, arthritis pain, neuropathic pain, and even cancer pain. Now, myself, the type of pain that I tend to treat is usually musculoskeletal pain, and in the pediatric population, I mostly would see teenagers who develop chronic pain or recurrent pain as the result of sports injuries or even growing pains. Just growing too fast can cause a lot of pain in children. Now, what about you, Tess? What has your experience been?
Yes, I would say that the majority of the peds population that comes in is for some kind of joint, maybe a developmental problem or within the joints, or some musculoskeletal issues. But also worth noting is that because we're going up to that 18 years of age, in the females we can also see some gynecological issues. Acupuncture can be very good for treating bad menstrual cramps.
Oh, of course, yes, that's very true. Now, what I'm going to do is basically give a brief description of acupuncture and how it works. So when we think of acupuncture, typically it's the insertion of fine needles at specific points in the body in order to cause pain relief. How we understand acupuncture is working is that it tends to stimulate the release of the body's own endorphins or opioid peptides, which then cause an analgesic effect. Now, generally when people come to see me for acupuncture for pain, I often recommend they come for at least 6 treatments over about a 2 to 3 week period, because don't you find that acupuncture usually has to be done close together initially in order to get the most benefit. Now, generally there are some people that get immediate pain relief using acupuncture, but generally I find usually it's a gradual improvement over those 2 to 3 weeks, and depending on the degree of improvement will determine how many more treatments they would need after that.
Yeah. Yes.
So some of the challenges that individuals with chronic pain face that can hinder healing is, I guess the first one would be, reduced mobility as the result of chronic pain, like just trying to get to the office in order to get treatments. And you came up with a really good problem, and is that with their sleep, right?
Yes, exactly. Yes, if their sleep is affected, then that will greatly exacerbate that pain cycle.
Yeah, absolutely. And also, people who are in chronic pain, and that includes children, will often, it can definitely affect both their mood and their energy. Mood-wise, people with chronic pain tend to be quite irritable or, quite despondent. They despair that they'll ever get better. And so as practitioners, I think a lot our role is to also, try to motivate them to make any lifestyle changes necessary, as well as to give them hope that, yes, they can get better. So what I'm going to do at this point, I'm going to turn the video off and I'm going to start, I'm going to put some needles in Tessa, and then we'll come back. See you in a sec.